Welcome to Police Custody Basics, and my name's Joanne Caffrey, and today's question is: must the custody sergeant comply with the HCPs instructions? So the custody officer complying with the healthcare professionals instructions in a police custody unit. And the very short answer is no, they don't have to comply with the HCPs direction at all, because it's advice. And before I go on to explain the safeguards around this, is first off, the custody officer, so the custody sergeant, they ultimately carry the can for everything that occurs in the custody unit. Now, in accordance with the Police and Criminal Evidence Act, Code C paragraph 9.5 and the Mental Health Act of 1983, the custody sergeant, so the custody officer, must ensure that appropriate medical attention is given as soon as practicable. And in order to facilitate that as soon as practicable, that's why we now have the embedded HCP service within the custody units. Now, medical attention may be required prior to the booking in procedure, so there's nothing wrong at all in, before the person's even brought to the desk, the HCP being asked to see the detained person to conduct a triage and decide if the person needs to go direct to hospital, for example. Where there is doubt, staff should err on the side of caution. So we've got to then be thinking about where a custody officer has concerns about the clinical direction received. So you may, for example, like a recent case that I was involved with, the custody officer originally grades the detainee a level 4 observation, so that's the highest level of risk. The HCP sees the person and then states level 1, which is the lowest level of risk, so there's been a massive change in relation to their observations. So the sergeant, even though, sort of like 20 minutes earlier had thought this person's presentation deserves a level 4, knocked it all down to level 1, and therefore certain safeguards were not afforded to the detainee that they would have received if they were a level 4. So here, where the custody officer has concerns about the clinical direction received, they are at liberty to escalate the matter to a senior member of healthcare staff or seek a second medical opinion. Now, in relation to the HCP's guidance, that's what it is, it's guidance, and the custody officer still needs to consider that in line with all the other information that they've got. And for this, they're going to need to consider the National Decision Making Model, the Thrive assessment, so your threat, harm, risk, investigation, vulnerability, engagement plan, and also your vulnerability assessment framework, so your ABDCE of the VAF. Now, whenever a custody officer has any suspicion or has been told in good faith that a suspect may be mentally vulnerable, then they must request an appropriate adult to be present, and that's covered under PACE Code C paragraph 1.4 note 1G. Now, that's where the custody officer has any doubt, so it's not where the HCP has any doubt. The legislation is where the custody officer has any doubt. So, and it's about mental vulnerability, and again, what I commonly see is the HCP will refer to they've conducted a mental capacity test on the detainee. But mental capacity, mentally disordered, mentally vulnerable all mean different things in law, and under PACE, mentally vulnerable is a much lower threshold, and a person can be mentally vulnerable without having a diagnosed mental health condition. So, and likewise, a person can have mental capacity and yet still be diagnosed with acute mental disorders. So here we're talking about mental vulnerability, so it's the lowest level, and if the custody sergeant, so the custody officer, has any suspicion or is told in good faith that the person may be mentally vulnerable, they must instigate the safeguards, and one of those is the appropriate adult. So back to the question, must the custody officer comply with the HCP instruction? Well, The short answer is no, because it's just advice. However, you must always be cautious and to err on the side of caution. So for example, if the HCP is recommending this person is on a level 3 or 4, and then the custody officer says, no, I'll put them on a level 1 because it's going to be easier, then that's not erring on the side of caution. But even if the HCP says, well, they think they can just be a level 1 because they've got mental capacity, it's still the liability of the custody sergeant to further investigate that line and to talk to the HCP about, to ensure that they're looking at mental vulnerability under the PACE or in relation to the full risk assessment picture, which the HCP might not have, remember. So it's about the conversation being shared and considering at the end of the day the custody officer is the one who is responsible. And it's no good saying for the custody officer in their defence, well, the HCP recommended that that's what happened, because it's the custody officer's responsibility and liability to take all of the information together, and then based on all of that information to consider together the threat and risk, and then the powers and policy, and then your tactical options, and to decide which is the most appropriate option to conduct. And if in doubt, seek a second clinical opinion. My name's Joanne Caffrey. This is Police Custody Basics. Thank you.